Hi, and welcome to another exciting YouTube video. We're talking about a topic which we've all heard of, the dreaded C word, yes, cancer. What does it mean? I mean, everyone thinks of it, they get very worried. And obviously, it's something that's very sad, but it's things that can potentially be preventable. And I'm Dr. Take It Easy, aka Dr. Rishi Shompal, and we're going to be talking about what we can do to help prevent and reduce the risk of getting cancer. So the next topic is the contents. What are we going to talk about in this YouTube video? Well, we're going to be talking about what is cancer, how common is cancer, the causes of cancer, how we can prevent it, and lifestyle changes. So it will be pretty brief, but it's important that we address these topics as soon as we can. So the question is, what is cancer? You can see from this animation here that there are some things which are growing and dividing, and there's another diagram here. But it is important to address the basics. All cancer begins in cells. Our bodies are made of more than 100 million cells. Wow, that's a lot of cells. And each cell is as shown in the diagram. And cancer begins with changes in one cell or a group of cells. So in this diagram and in this picture, you can see a normal cell and a cancer cell. And cancer essentially is when abnormal cells divide in an uncontrollable way, such as shown in the diagram above. So the next question is, how common is cancer? As this diagram shows, the disease accounts for around 7.4 million deaths worldwide. And there are different types of cancers. There are actually, in fact, over 200 different types of cancers. And how common is it? Well, unfortunately, 1 in 2 people in the UK will get cancer. That's 50% of the population, which is a large amount of people. What are the commonest types of cancers? Well, in the UK, the 4 most common types of cancers are breast cancer, followed by lung cancer, followed by prostate cancer, and then bowel cancer. If you look at the diagram, you can see that men and women are different, and each cancers are more common in one group compared to others. For example, men have higher rates of prostate cancer, women have higher rates of breast cancer. So what are the causes of cancer? I mean, there are a number of causes, but the list that I've included here are the most studied or suspected risk factors for cancer. Naturally, some risk factors cannot be avoided, and you just have to get older, essentially, and that's one of the risk factors which we can't change. As one gets older, one's risk of cancer increases. But there are some limiting your exposure to avoidable risk factors which may lower your risk of developing certain cancers. Alcohol, diet, obesity, sun exposure, and tobacco. We're going to go through each of these in turn. So like I said, prevention of cancer. This is a nice picture from The Simpsons. But essentially, smoking cessation, or the stopping of smoking, or not starting it preferably, is a very, very important risk factor. And smoking has been linked to various types of cancer, including lung, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Chewing tobacco has also been linked to cancer of the oral cavity and pancreas. Even if you don't smoke, it's important to remember the risk of secondhand exposure to smoke. That is, being around people who are smokers, that also increases your risk of lung cancer. So avoiding tobacco or deciding to stop using it is an important part of cancer prevention. If you need help quitting tobacco, ask your doctor about stop smoking products and other strategies for quitting. Secondly, is eat a healthy diet. Yes, that sounds great, but what does that mean really? Eating a healthy diet means eating plenty of fruits and vegetables. Look at that lovely diagram, or that lovely cartoon you've got of that healthy, strong cartoon having those nice fruit and vegetables. So, base your diet on fruits and vegetables and other sources of plant-based foods such as whole grains and beans. So it's important to avoid obesity. That means eat lighter and leaner by choosing fewer higher calorie foods, including refined sugars and fats from animal sources. Another thing to remember about preventing cancer is, I love this diagram. He was going to drink the bottle, he hit the bottle hard, he's going to drown those feelings. We talked about this in the previous topic about mental health, but it's about alcohol. Alcohol is something that, as a society, we don't frown upon. And it's okay to drink alcohol if you want, but do so in moderation. And if you're doing it because you're forced to do it or peers sort of tell you to do it, it's important to step back and question whether it's worth it. So there are risks of various types of cancers, including cancer of the breast, colon, lung, kidney, and liver. And these increase with the amount of alcohol you drink and the length of time you've been drinking regularly. So if you can, reduce or stop drinking. And next we're going to talk about being active and maintaining a healthy weight. Yes, this little cute picture you can see are all these vegetables and fruits, which are also very important. Being active, using some weights. So it's important to maintain a healthy weight and be physically active, as I said. Healthy weight might lower the risk of various types of cancer, including cancer of the breast, prostate, lung, colon, and kidney. Physical activity counts too. In addition to helping control your weight, physical activity on its own might lower the risk of certain cancers. So we recommend roughly participating in about 150 minutes a week of moderate exercise or 75 minutes a week of vigorous exercise. Generally, just think of it basically as at least you should try and do 30 minutes of physical activity in your daily routine. If you can do more, that's better. But something is important. Also, the sun. Yes, skin cancer is one of the most commonest types of cancers one can get based on sun exposure, and it's highly preventable. So try and avoid the midday sun between the hours of like 10 a.m. to 2 p.m. unless you're in England in the winter or autumn. So yes, if you live in a hot country, try and avoid the sun in high risk areas, and obviously use UV protection and so on and so forth. Lastly is avoid risky behavior. Another effective cancer prevention tactic is to avoid risky behavior that can lead to infections. So practice safe sex. Ideally limit the number of sexual partners you have and use a condom when you have sex. The more sexual partners you have, the more likely you are to contract an STI, an sexually transmitted infection such as HIV or HPV. People that have HIV or AIDS have a higher risk of cancer of certain types, and HPV, human papillomavirus, is most commonly associated with cervical cancer, but it does increase the risk of other cancers. So what are the lifestyle changes one can help to prevent cancer? My mantra as Dr. Chompao at Dr. Take It Easy is always to be active, to make sure that we as people and as a society take our health very seriously, and it's always going to be prevention is the cure. So it's interesting, 30% or a third of cancers can be prevented by lifestyle changes. So lifestyle is something we can take control over, and experts, including myself, believe making the following lifestyle changes can be significant in preventing measures of getting cancer. Stay smoke free, keep a healthy weight, eat a healthy plant-based diet, reduce alcohol, exercise regularly, enjoy the sun. Because remember, we are all responsible for our own health. So thank you very much for this quick introduction about cancer. If you have any questions, comments, I will answer every single one of them. If you have any topics you'd like to talk about, please mention them down below. And I will see you in the next YouTube video. And as always, take it easy.